Hello, friends. We are back with another case. A young child presents with fever and pustular skin rash with yellow crust around the lips and arms. And the culture from the lesion shows gram-positive cocaine genes, which are beta-hemolytic in nature. The patient is given penicillin G, and the doctor cautions the parent that the child may have temporary smoky-colored urine soon. So this condition is basically impetigo, which is a skin and soft tissue infection, and causative agent is Streptococcus pyogenes. Now let us first understand the pathogenesis. So these bacteria, they are normal flora of skin as well as oropharynx. The trauma usually inoculates bacteria in the skin, which causes colonization and which leads to inflammation. And that ultimately leads to formation of pus-producing lesions, that is pyogenic lesions, ultimately resulting in honeycomb-like crust, which is known as impetigo at site of inoculation, which is seen in this case. Deeper infection may result in erysipelas or cellulitis. Spontaneous recovery is usually seen, but it may lead to anti-streptococcal antibody formation, which may cross-react with human tissue because some of the streptococcal antigen, they are very similar to some of the human tissues. So the antibody that we form against streptococci may cross-react and damage these human tissues. So mainly kidneys, that is glomerulonephritis. But it does not cause heart or joint and other skin part involvement. So acute rheumatic fever is not seen in impetigo. So if it was thought that this antibody can cause both the things, glomerulonephritis or acute rheumatic fever, but here the skin strains, they usually cause glomerulonephritis as an immunological complication. Now, what are the virulence factor which will promote spread and inflammation of this bacteria? So earlier also we have discussed this, that AMP protein in the cell wall that inhibits phagocytosis. It has streptokinase which converts plasminogen to plasmin and cause fibrinolysis. The third virulence factor is hyaluronidase, which breaks down the connective tissue barrier, mainly made up of hyaluronic acid, and DNAs will digest the DNA and make the pus liquid in nature, which is easy to spread. So coming to investigation, we can do the lesion culture, that is skin lesions. A sample is taken and sent for culture and sensitivity. And you can see the gram-positive cocaine chain, which are scateless negative. So they are streptococci, beta-hemolytic, and they're sensitive to bacitracin. This will stamp it out as Streptococcus pyogenes. Treatment is obviously they are penicillin sensitive, so we will give penicillin G. Thanks for listening to the session. I hope you enjoy it.